Our final speaker this evening is our new Chief Medical Officer in the Cayman Islands, Dr. Nick Gent. We welcome you to the Cayman Islands. Let's hope you've been getting some Cayman-kind hospitality as you've settled in. Welcome.
Premier, Deputy Premier, Minister and colleagues, yes, I've been extremely well welcomed to the islands and thank you very much. I'm also acutely aware that I'm standing between you and a cocktail reception, so I am not going to take a lot of time. There's just three things that I distill down my early thinking in this post. Firstly, we're moving into a period where we are living with COVID and we must renew our focus on public health. We've got to get away from the trenches. And in that respect, can I remind you all that everybody in this room is part of the public health workforce? Okay? Yes, there are the sort of core things that public health people get excited about, like immunisation, surveillance, communicable and non-communicable disease, monitoring the state of the population, but also those much more difficult things such as lifestyle and access to the right qualities of healthcare at the right time. And we need to make sure that we supplement and support the old approaches with grasping new and novel opportunities as they arise. But let me return to this point about us all being part of the public health workforce. The really difficult challenges around the non-communicable disease need commitment week in, week out, year in, year out, and are difficult. Just take two of the top issues, coronary heart disease and diabetes. I'm not going to lecture you about the origins. We all know the principal risk factors, and we all know what we have to do to change those risk factors for the population. They are not easy. They're unpopular, they're hard to deliver effectively, and they're things that get opposed by commercial interests as well. And if we allow ourselves to be split apart, we do not act as one on these things, we will lose these things. We will lose the opportunities. Finally, there's the third thing I want to touch on, because I just want to leave some key points in your mind and not overwhelm you with lots of detail. I know that this has already been mentioned by Ian Cumming, and I know it's close to the heart of my minister, and that is the training and development opportunities for Caymanians. And in the healthcare system, they are really, really important. Whenever I'm going to be sitting down to a meeting with people about opportunities, new developments, or whatever, don't be surprised if one of the questions I ask is, how does this enable a pathway to qualification, experience, and accreditation so we can get more and more Caymanians joining our professional healthcare workforce? That's not just giving opportunity and aspiration, especially to young people. I would suggest it is absolutely critical to us securing the future of our health and public healthcare services in these islands. Thank you.